Hey, Dr. Lindsey here. Wendy and I are going to talk to you about 18 months results on a lady that had 13 or 1400 modified FUE grafts to repair right-sided alopecia. Probably associated with the female type hair loss. She's got a little bit on both sides, and it really affected her so that she had to comb her hair down in front of her right ear. And while I didn't think that she looked like she was covering things up, like many women, she was convinced that every woman that she passed at the grocery store saw that she had no hair in that area, and every man that she passed by noticed it, and so it was a huge deal to her. And so I had worked with her mother a few years ago on something other than hair, and she came in and talked with Wendy about this. And tell your side of the story, Wendy.
Well, when she saw me, and I said, "Oh, let me see," and she showed me. She's like, "You guys changed my life." And I said, "Can you let Dr. Lindsey know that?" And then she didn't tell you.
As usual, you're getting ahead of yourself. Tell me what she said when you first met her. So, how did you find her, Wendy, or how did she find us?
Well, I met her at church, and I said something about her hair, like the color that she had on, and then she covered to the front. I said, "Why are you covering?" And then she showed me her patch that she had there, and she was saying how awful on her. I said, "It could be fixed. Something could be done." And I told her what I did, and that's how she came here. And
so you interacted with her a lot around the time of the surgery. And then we didn't hear from her. We kept trying to call, as is often the case. We only hear from people that got a gripe. And so, and unfortunately that's not very often. But, you know, this is a success story. We never hear from them. They said you ran into her where?
I went to a viewing on Saturday, and I saw her, and I gave her a hug, and she's like, "Oh, Wendy, you guys changed my life. I need to come." And I said, "Well, you need to come and tell Dr. Lindsey that."
Yes.
And she's like, I do owe him that. I said, "Yes, you do." And she came today. She was off today. It's a holiday.
And she looked great.
Oh, it looks very natural. It looks really pretty. Like it.
But let me tell you, I comment on it during the video. You know, these hairs right here are wispy, crappy little hairs, even on people that have normal hair. And these hairs back here are typically thicker. And so when we move hair from here to here, the texture doesn't match. It's a little thicker. Now, on this lady who had no hair, and you can put a tree stump there and it's been better than nothing. But on guys who want this little sideburn fixed up, usually you can't get it that match real well. And so I try not to do that on most patients. Occasionally we do a Seek who's had auto extraction. But you know, pay attention in the video that these hairs that we've put in this lady are a little thicker. And if you know, she was really scrutinizing, you know, you could tell this, but she's just happy to have some hair there, and it really does look natural.
Nicer to have thicker hair around here for us girls, but for guys, when you cut it short, it doesn't look as natural as it looks on her.
Right. Yeah.
Yeah.
Okay, so enjoy the video. Thank you. Okay, so this is a 1.5-year update on this modified FUE to fix, I think it was your right side, right?
Yeah.
And this is her donor area. This is pretty typical. People, you're tempted to think that's the scar. That's not the scar. That's where her hair's parted. Her little MFUE punches are right up here, and that was before we were doing 2 layers. Our scars now are probably a little bit better than that, but still pretty easy. How long did it stay numb? A long time?
No, it was probably like a week or 2.
Okay. Okay, so now we're looking at the recipient area, and I haven't asked her what she thinks yet, but man, that's a lot of hair that's growing there. And if I had one complaint, and I knew this was going to happen before we did it, it's that the hairs we take out of the back of your head, even though you get fine silky hairs, they're thicker than the wispy stuff that's normally here. which is usually good, but if I were judging it from an aesthetic point of view, the hairs themselves are too thick, but that's what you got to work with. So, are you happy to?
Yes, it's a life-changing experience. As far as appearance-wise, it makes you feel more confident. It looks natural. It was worth it.
Oh, fantastic. I'm so glad for you. And I've worked on your mom, right? And didn't I work on your mom at one point?
As far as her...
No, just something. I did something for your mother, right? Yeah.
Right.
And so I've known you guys for a couple of years. I knew your mom for a couple of years before I met you. Correct. I'm really glad we did this.
Yeah, me too.
All right. Any advice you want to give people, or anything you want to say? Or
if you're thinking about it, I would definitely say it gives your confidence back. It's worth it. The pain is minimal. In the overall, you will definitely be satisfied with the work that Dr. Lindsey provides.
All right. Thank you so much. All right, so no sooner do I turn off the camera and she tells me a bunch of stuff that needs to be said. So say what you just said again?
Before, I couldn't pull my hair back because my hair was very thin and bald. So after the procedure, it's definitely changed my life. I'm able to pull my hair back, have more confidence, whereas before I would have to wear my hair covered to the right to cover my bald spot. So yeah, it's definitely a life-changing experience. Thank you, Dr. Lindsey.
All right.